but it was apparent that there wasn't a cumulative effort. There wasn't a way to bring everybody's ideas together. And I think as you convened the first meeting that we had at the College of Lake County, and we literally filled up a meeting room with stakeholders from the community that were, concerned and wanted to make a difference, but didn't quite have that way to bring everyone together. And that's what you did. And as we got together, we started to think about, and brainstorm. Literally, we had brainstorming sessions with the community to think about, how can we impact, this crisis? And as, time went by, we put together a strategic plan. We used a model to do that. We got input from everyone, and the strength comes from the community. And that's what's great about Lake County is, if there's a problem, you can call a meeting and, everybody that can, impact it shows up and wants to help and will roll their sleeves up and get to work. And I think, as we started to become more sophisticated and we started to grow, now we have, almost 300 members, 175 separate organizations are represented. We actually, oftentimes run out of room at, the largest meeting space at the College of Lake County. And, this continues to be an effort. And as we've become more sophisticated, we have working committees that now address various strategies. We have a policy, legislative, and legal issues committee, a communications assessment and evaluation committee, and that's where that data from Dr. Cooper and his office is so valuable for us. We have a first responders committee that really has been the impetus for a couple of our initiatives. They've been great, both the police and fire. Primary prevention, education, and awareness. We have medical professionals, and Dr. Rubenstein's actually, one of the co-leads on that and does a great job. Treatment, recovery, and family services, and harm reduction. There are members in each one of these committees that work tirelessly to advance these strategies. And, from these committees and from some of the work and, really your facilitation of some of these strategies, we've come up with some what are now programs that are national models. So, the fact that the Lake County Opioid Initiative, team members have gone not just in Lake County, but throughout Illinois and actually throughout the country to share what we've done over these past 7 years.
I think we might have lost Bruce there. He
uh-oh.
A little technical difficulty. So I'm going to switch over while we wait for Bruce to catch up to.
I'm still hearing him.
Oh, yeah, I still hear him.
I think you've frozen, Mike.
Yeah.
Just talk amongst ourselves.
So Bruce, I'm going to take over. I mean, no one can fill in Mike's shoes, but you're talking about something important. Why don't you continue? We'll
Thank
get Mike
you.
back.
Thanks. So what I was going to say is that, we've gone over the country literally to share these models. And I like to think of the first thing we kind of bit off, was our naloxone for first responders.
Right.
And, equipping our law enforcement with naloxone in, every squad car in Lake County. I mean, to think that now doing that, we've saved hundreds, almost 400 lives because that happened. Law enforcement, what a great partner in what they've done. And the health department helping in partnership with law enforcement to provide the naloxone and the training. Fantastic. And interesting, law enforcement actually helped to birth our next initiative, which was the A Way Out program, which helps to get, individuals needing treatment access to that. Huge. So these committees and the work of our committee members have really been, essential to the opioid initiative and what we've been able to accomplish. We also had an initiative of text a tip, which that came out of the opioid initiative, and great organization lead actually developed text a tip. And there are thousands of people in, throughout all of the schools in Lake County, as well as adults, but really we've seen a lot of use from our youth, and they can text and get immediate help for a crisis that they're having or someone else is having. These are great initiatives that have been, really big game changers, I think, in Lake County. And I'd like to echo what, Dr. Cooper said, and also what Mike said, is that I shudder to think if we didn't have these, strategies, if we didn't all come together and we didn't use our collective, resources and, everybody's efforts, I think Lake County would be in a much worse position. I know that to be true. So the Opioid Initiative, as to put it succinctly, it's really helped to save lives, and it's accomplishing exactly what we wanted to accomplish in the beginning. And there's so much more work to do, but we have this great group that is willing to continue to fight these, to fight within these strategies, and I think that's really important. So that's probably hopefully I answered his question and gave a little bit of the history.
I think you did a great job, and I'm going to fill in for him just because I want to, and I said I would. So let's turn to
Fair
Dr.
enough.
Roberson. By the way, we have a lot more to hear from you, Bruce. That was very well said. I know there's a lot more you can say, but let's turn to Dr. Roberson. So you're a crucial pillar at LCOI. You're really important. What you do there, I don't think anybody else could do the way you do it. And you're aware of what it means to help people find housing and get their life on track, get support that they need with basic services. So what is the importance of long-term services and housing and all the needs that people have, their essential needs? What's the importance of that to actually people getting into recovery and staying there?
Okay, so thank you to Mr. Mike Nerheim, who's not here, but great question. One of the things that I know when individuals are faced with the challenges of an opiate use disorder or any substance use disorder for that matter, most people get to the point where they want to stop the consequences associated with addiction and mental health. And some of those consequences are loss of housing, loss of family connections, and legal problems, esteem problems. So they begin to ask for support by seeking treatment or in some cases, recovery support services. One of the things that I know on a national and on a local level, that there's a lot of treatment services that's been very, very successful, particularly here in Lake County with all of the service providers that we have. Across the nation, there's an estimated 21 million people 12 and older who need substance use treatment. 3.7 million of those individuals have actually sought out treatment. And then another 2.4 million, go to a specific treatment facility. But there's some disparity that's known as a treatment gap. And we sometimes have to really look at those things. One of the things that we know here in Illinois and Lake County, that housing is a vital part of the services that individuals who are seeking and gaining recovery that they need. We have a robust community of providers here, and one of them is housing, coalition, housing advocacy, because it's important that when an individual go through like a way out program, or any particular treatment program, that they go back into a safe living environment. And that safe living environment has to be supportive of the treatment that they receive and also their discharge planning. And here in Lake County, we are pretty fortunate because we advocate for those kind of services. Although there's a strong homeless population, we also have a robust community providers that's providing those housing services. And in my career, I have been a big part of housing advocacy. I've been a big part of the recovery support services, the treatment services, and I know that we have been successful in doing that. One thing that I know too, is when people come back from treatment, treatment service, that it's important that they be supported, because it's like, you know, the old adage, if you go to a barbershop long enough, you're gonna eventually get a haircut. Well, it's the same situation if you go back to a dysfunctional community environment or housing environment, you're eventually gonna return back to active usage. So it's important that we have safe recovery housing available for individuals when they come back from treatment. The other part of it is that there's a big representation of those underrepresented individuals, such as communities of colors. One of the things that we have been talking about for pre-COVID at the Lake County Opioid Initiative is that we have to find a way to really get the communities of color that's engaged. I don't have the data in front of me, but I know that it was a little bit skewed when we looked at the number of people who were being saved or going into treatment, and the percentage of the communities of color was underrepresented. I think that that's one of the biggest challenges that we are faced, but knowing Lake County and all of us and the things that we've been doing, we're gonna tackle that just like we did the opioid crisis. Are we done with our work? No, we're not. There's still a lot more work to be done, but I think that collectively and supportively that we could get those things done. So I'm gonna stop right there for now.
Thank you so much. I was going to ask what we can do to be more effective. You've already covered that. You really gave a nice description. I think that we all overlook the importance of the basics. We talk in my field about treating diabetes, making sure people take their medicine, making sure people can afford it. If you don't have a roof over your head, I'm not sure how you're going to actually deal with an overwhelming problem such as substance use disorder. So you're really a hero to me in our community. Let's turn to Bill.
Thank you.
Bill's the guy who, when I heard about this panel, I said, oh shoot, Bill Gentis. He's so smart. He knows so much. He's just going to make us all look bad. The guys, you are really it. So why don't you talk to us a little bit about what you do and what your organization does and how you guys fit into Lake County Opioid Initiative.
Adam, thank you for letting me get a word in edgewise. So we do a lot at Lake County Opioid Initiative. You know, Bruce talked about some of the programs we do, but one of the most valuable things, and everyone here on this panel with me speaks in public about this issue a lot, but there are two things that I always see when I speak that resonate, facts on these opioid things, on the opioid epidemic is the first one is to put the epidemic into perspective. Is every day in the United States, this is like an aircraft crashing, and it's a commercial airliner that's like a 727 crashing, because we lose 180 people every single day in this country. Last year, that number was 72,000. And you know, that really puts it into context. The other thing I say is that everyone in the United States, virtually everyone in the United States, knows someone suffering from a substance use disorder. That's how prevalent it is. And you know, that I can see when I speak, those audiences really sort of, that resonates with them, because they all think, oh yeah, I know Phil. Yeah. And so those are some of the things we do. And that education effort's been taking place for a long, long time, ever since the organization has been founded. And, you know, we do, the organization does an awful lot of other things. And Bruce talked about a couple of them, but there are a couple others. You know, we have a prescription drug disposal network. Every single police station, except for one in Lake County, you can take your unwanted, unused prescription drugs and take them to a police station and drop them off, no questions asked. They're disposed of properly, environmentally, by SWALCO, and it's a partnership we have with SWALCO, which is a solid waste agency of Lake County. We also do needle exchanges in a partnership with Lake County Health Department. You can get clean needles, which is a proven strategy for reducing disease. You know, the naloxone for first responders, you know, Bruce was talking about that. The exact number as of like a week ago is 382 people. And when we think about the numbers that Dr. Cooper was talking about, you know, those are 382 people who are dying. They're laying on the floor turning blue, waiting for paramedics to show up, and law enforcement is able to, in those crucial 1 to 2 minutes, save that life potentially. So even if we, for argument's sake, in the last, I think we've had the program for about 5 years, divide 380 by 5, and that's the actual numbers that you would see. So when Dr. Cooper says we potentially have 70, we could easily have 130 this year. And that would, and the context of that is horrifying, because that's a really bad. I mean, we're fortunate that these programs are here. The other one that we do a lot with is fentanyl test strips. You can test your drugs before you use them to see if there's fentanyl in them, because fentanyl is something that's popped up. And I know Dr. Cooper, and I should in parentheses say that Dr. Cooper has stepped up since he was elected with advanced toxicology tests for any suspected overdoses, which gives us an enormous amount of information about what's in the body. And we've learned a lot of stuff. I mean, we know how much naloxone is in the body. We also know what multiple substances are in the body, which is very, very valuable. And Dr. Cooper, I know you didn't have to do that. I mean, a basic toxicology would have been enough, but we very much appreciate that, because that data is insanely valuable to us. You know, and to talk about, you know, some of our programs, the A Way Out program, which is a partnership that we have with the Lake County Health Department and 15 municipal police departments. And over the years, we've had, as of this morning, 732 people pass through this program since July of 2016. And that program, you know, has put people into treatment. And if you have an addiction, you can walk into a police department and you have something you need to correct. You can walk into a police department, and rather than arresting you, they'll get you help. And then they'll drive you to wherever we find the appropriate treatment for you. And, you know, that's an amazing sea change for law enforcement. And you know, the Way Out program is well received. And a lot of that is because of our partnerships. You know, we worked with the recovery community. We worked with our law enforcement community. We worked with judges, parole officers, attorneys, you know, everyone that came to the table. And that's the value of this organization that was set up by Mike and Bruce and George and Chelsea. You know, this is an amazing thing. And the last thing I would also say to your point, Mary, about housing, one of the things that we've done is we've been able to raise money successfully over the years. And especially with this COVID crisis, I'm in charge of the checkbook for LCOI, and I've been writing checks for people to get them into sober living and to get them into housing and to get them back on their feet throughout this crisis, because obviously, you know, this has put an immense pressure on people. So we have a scholarship program where we help those in need find housing and opportunities. And you know, that's an amazing thing. And that's something that very few other counties do. So I think that answers all your questions, Adam / Mike.
Well, Doctor, thanks for covering for me. I apologize about
chair, but I'll let you take it now.
So, yeah, I had some technical difficulties, but it wouldn't be a Zoom call without some. So appreciate everybody stepping up. And Dr. Roberson and Bruce, I could hear your answers. I just couldn't see you. And but I appreciate everything that you had to add. And certainly, I know we've all been on, as I said before, we've all been on a lot of panels together. And you know, this is just a message that we really have to all continue to get out there. Bill, I want to go back to you if I could. You touched on a couple of things that I think we probably want to highlight a little bit more. The first one is fentanyl, and Dr. Cooper can jump in here as well. You know, I was looking at, I gave a presentation earlier today on this topic, and I was looking at our overdose death data here in Lake County. And one thing struck me when you look at fentanyl, and fentanyl, for those of you that are listening that don't know, is a synthetic opiate that is many more times more potent than heroin. And it's killing a lot of people in our community. People are consuming fentanyl that don't know they're consuming fentanyl. Fentanyl is mixed with other drugs. Most recently, we're seeing fentanyl show up in club drugs like ecstasy and things like that. And the people that are taking those drugs have no idea that they're consuming fentanyl, and they're dying, which is why those test strips are so important. But one of the things I noticed in looking at that data was in 2015, that's really when fentanyl started to show up here in Lake County. Prior to that, it didn't show up in the toxicology. In 2015, we had a handful of cases, and it seems to me that every year since then, there's been a pretty steady increase of fentanyl showing up in our toxicology. Anybody on the panel want to weigh in on that? Thoughts?
I mean, I can certainly say that, yeah, I mean, we're definitely seeing more and more. There's no question about it. And the other part of fentanyl that people may not know is that because fentanyl is made in a laboratory, it gets tweaked and they change it every, whenever they want, the chemists that are making it. And so there's many different kinds of fentanyl. Some of those are over 100 times more potent than heroin. And so we're testing for a lot of different kinds of fentanyls as well. And sometimes we'll find drugs that, at the very beginning, we're seeing it in the US where we don't have tests for it. And then they're finding tests for these different types of fentanyl. But it's more and more prevalent. We're seeing it really all the time now. It's much more common than it was years ago.
I think there's a couple of paradoxes in there, Mike. One is that fentanyl, of course, was first brought out many years ago, and it was the same company as Bayer aspirin that actually brought that to the world. And the guy who first formulated it said that this would never be a drug that would be abused. And in fact, it's the drug that's leading to the fastest rate of rise of overdose deaths. The other thing that I find unfortunate is that for a long time, fentanyl was only being manufactured and brought in from China. Then, of course, there were routes through Mexico, and you had to find a way to get it in and smuggle it in if you weren't going to steal it from a hospital. But now anybody who knows what they're doing with chemistry can just make this stuff in their basement and make it all around. You don't have to actually bring it in anywhere. It's a lot cheaper to make it and have it here locally, which is why they keep changing the formula. So LCOI has so many important components to helping people to not become addicted by preventing it. And that's, to your credit, the talks that you're giving and the talks you're giving, Howard, are helping people to actually make good decisions. But we also have all these other, treatment plans in place. If anyone is set up to handle a problem like fentanyl, which is really just like a monster that keeps growing, it's Lake County, because we have all these things in place. And I think that, Howard, you following it so closely and isolating these different formulations of fentanyl, it's helpful to all of us.
Doctor, I couldn't help but think when you mentioned just a minute ago about how fentanyl was first promoted as being not an addictive issue. I couldn't help but thinking of another drug called Oxycontin that was developed a few years ago, and the manufacturer of that company spent a great deal of effort in marketing to physicians in the world that that drug was not addictive and would not lead to long-term addiction. Can you talk a little bit about, from the perspective of a physician, what role, if any, the prescription or some would describe overprescription of prescription opiate pain medication has played in getting us to where we are?
Sure, absolutely. And this is a huge issue because of all the people that Dr. Roberson were quoting. She was quoting 2.1 million people either addicted or severely abusing opioids right now in this country over the age of 12. 3/4 of those are actually having substance use disorder for prescription pain pills. They got that prescription from a physician or from someone else who got it from someone who wrote it on their pad or their computer like me. So the real issue then is, why does that happen? And that's because we physicians were not trained properly. When I went to med school way back when, in the late 80s, the only lecture we got on this was telling us that if people have chronic pain, they are not ever going to get addicted. 3 out of 2,000 people will be addicted. You don't have to worry about it. But the fact is that's not true. And so we weren't really taught enough about how to handle the problem. And we were always giving the same prescription for, really, then it was Vicodin, now it's Norco. People have a back pain, people have a sprained ankle, they have a migraine. We just wrote those scripts. And we weren't actually aware of what we were doing. Now we have a much better idea of it, but there were a lot of inputs for that. One of them was that drug company you're mentioning, who was going around to all of our offices and telling us, you know what, you have to give these meds 4 times a day. Ours is twice a day. It's better. Just give ours. And it really was a drug that was wearing off and patients were getting withdrawal and they needed more. And that literally led to a whole host of people who otherwise would not be dependent on opioids seeking them out. The other thing is that we basically are a country that's set up to want to solve every problem people have, right? So we're measuring pain levels in the hospital because we decided that's the 5th vital sign. And if someone has a pain level that's notable, we want to give them medicine. Now that's turning around. Physicians are now starting to lead the way in decreasing the number of prescriptions, prescribing naloxone along with opioids that they prescribe if they have to be. And I would just say to the people listening, you don't have to take those pills that are prescribed to you. If you're in the ER and you have a painful condition from a motor vehicle accident or a sprain, if they give you a prescription for more than 3 days worth, just stop at the 3rd day or don't take them if you don't need them. And that's true for post-operative also. And if you find that you are liking them because there's a hereditary component, help is available. You can get through to LCOI and they'll connect you with treatment providers, and always look for a program that offers some form of what we call medication-assisted treatment, which is one of 3 medicines that the government recognizes as evidence-based to work, along with psychosocial support and counseling.
Can you talk a little bit more about medically assisted treatment and how you use that in your practice? And
Absolutely. So, yeah, so I'll just give the basics. Basically, we have to start out by saying that addiction is a chronic brain disease. Addiction is not a moral failing. It's not someone who's a glutton for pleasure. People who are prescribed 1 dose only of Norco or OxyContin, of all of them in America who take 1 dose only, 6% will still be using it a year later. And that's because their brain likes it. They either get turned on and like it, or it helps them get pulled away from their problems. That's a hereditary thing. So basically, when we have a person who has this type of problem, their areas of the brain get lit up that actually have to do with pleasure and reward whenever they contact an opioid. And initially, they really look for that to be repeated. After a very short time, the thing that drives chronic use is withdrawal. It's not that your neighbor who has addiction, why don't they just stop and get a job? Why are they glutton for happiness? It's not about that anymore. They feel like they're going to die if they don't get that drug of choice. Medication-assisted treatment is one of 3 medicines. There's methadone that's been around since the 50s. We have buprenorphine that's been on the market in the US since 2003. And we have naltrexone, which is an injectable drug. And all of them have different formulations, how they can be given. But the way they all work is similar. They break that cycle. There's a cycle of using, and either I feel a lot of pleasure or I just am glad I'm not in withdrawal. Then withdrawal, I feel like I'm going to die. I'll do anything I need to get my drug of choice. And I just want to put in here that law enforcement in Lake County gets that. And that's why a way out program is brilliant. I mean, Mike, I have to tell you, before I grew up, if you told me I had to meet a state's attorney, I would have been like, no way, truthfully. And actually, I told my son, who's 8 today, before this, he asked me who was going to be on the panel. And I began by mentioning Howard. I said, well, a coroner. And he said, oh, what do they do? And when I told him, he said, oh my God, that's the saddest job. Like who would want to be in a job where you have to meet all these people who are dead? And I said to him, actually, Howard is in a job where he's keeping people alive, right? He's actually doing the opposite. He's keeping people alive, which is what LCOI is about. And so when people have someone in the family, a friend, someone they know who has this problem, number one, don't judge them. This is not to be judged, just like diabetes, high blood pressure, and asthma should not be judged. This is controllable, not curable. The medications that we know are likely to work are evidence-based. They're proven to be very likely to work. And so in a treatment program that involves support, counseling, and medication, people can do very well. And what I would say is I've seen people come to my office who are in the height of chaos. They're disheveled, they're poor hygiene, their world is falling apart, they've broken bonds, they've committed crimes and lied. And in a very short time, their head's above water and they're looking good and they're feeling better, and now they can go to counseling. And suddenly they can think about setting new goals, repairing those bonds that have been broken. So medication-assisted treatment is the way to do that. I think it's not for everybody, but we should start with that. And basically, it fits in beautifully with the naloxone program so that we're saving lives with naloxone. Something I learned about through LCOI, by the way, I learned about co-prescribing through LCOI. Walked in the room when I first got involved, thinking that I was going to be in a room with a bunch of physicians and nurse practitioners and PAs. And actually, it's a room of all of you, right? It's all of you. It's amazing to me that I'm in the minority in that room. And you guys are saving way more lives than I ever will. And I'm just, I'm proud to be with you. I'm humbled by being on this panel with you guys, because all of you are saving lives and preventing deaths in large numbers of people right here in our own community. And that's something not to be, really not to be understated. And Mike, to your credit, you run this organization extremely well. I think that you and Chelsea and Bruce are leaders. Everybody looks to you. When I lecture around the country, people know about LCOI in other states. A lot of them have built their programs around what we're doing. And so I just have to thank you very much, because there was a time I felt like I was in a silo doing this myself in my office and not really, I mean, when I started doing this in 2008, I didn't have any support. I didn't even know fully what I was doing. I was just going little by little. And now I feel very comfortable doing what I'm doing. And I also feel that there's a totality where there's sort of like treating the whole person and the whole community is what's happening now. And that's a tribute to you, Mike, and to everybody who's on this panel.
Well, thanks, Doctor. You know, I think the secret of our success with the opioid initiative has been what you just said and what Bruce alluded to earlier. It's the fact that we have so many people that come together. And pre-COVID, we were meeting every month in person at the College of Lake County. And I would just pause for a minute and throw it out there to people that are watching that might want to get involved. We'd love to have anybody involved in the opioid initiative. There's no secret to the membership. We have people from all different walks of life that are part of our group. We have physicians, we have lawmakers, we have law enforcement, we have people in recovery, family members, people who have lost loved ones to overdose, treatment providers, you name it. And I think that's what makes our group so powerful. And we also have people from a lot of different viewpoints on the best way to address this issue.
Yeah.
And I think that diversity of opinion is one of the reasons why we've been so successful, because we do welcome people with all different thoughts on the best way out of this, and everybody's working together. And it's rare that you can go to a monthly meeting and walk out of that meeting, especially when the subject matter is this issue, which can be pretty heavy, certainly. But to walk out of a meeting and feel so positive about the impact that people are having, and to see all those people working together has been great. And I gotta say, it's been awesome to be a part of, and it's been great to watch it grow. And I know it's going to continue to grow. And there's some really exciting programs certainly that we've implemented, but more to come, right? Naloxone, we talked about naloxone, and we talked about the importance back in, gosh, it was 2013 when we wanted to equip every police officer in Lake County with naloxone. Naloxone, of course, being the overdose antidote to an opiate overdose. And the importance of that was we recognized, and I think we have to give credit to our police first responders, because they sort of brought this issue to the table and said, you know, look, we're going to these scenes of overdoses. We're almost always arriving.
Well, I think we lost Mike. I was, I listened into him though, and I'm thinking, yeah, they get there and they're waiting for, the paramedics to arrive, and, they feel a little bit helpless, and, their heart goes up, their adrenaline's going, and, somebody's life is hanging in the balance. And, to be able to provide that, and, we went through a lot of hoops to make that happen, and law enforcement and Mike kind of led that charge. And, the result is these, the savings of all these lives. And again, law enforcement, started to save people. And, once they're saving them, what happens? They ended up, maybe going to the hospital and then getting discharged only, a few hours later. And then if they actually use again, now you're trying to save somebody twice, and law enforcement's going, wait, there's got to be a better way. And how can we help these people and get them into treatment and get them the help they need? And, again, it just, to me, that is really an evolution of law enforcement, to be that entity that's going to say, what can we do about this? How can we help? And we don't, it's great that we're saving somebody, but we want them to then get help. And I think the efforts of LCOI to make that happen through the Way Out program, and the recovery community, their help involved in that, and being the spokesperson for us in the community. 700 and some odd people don't just walk into a police station, asking for this kind of help from police. So,
right.
Having the recovery community and the support saying, no, you can trust them. This is something different. They're going to help you regardless of what issue you have. They're going to help you. And, it's been proven time and time again. And, we've had individuals come in from, everywhere. I mean, they come in from everywhere, and some of them have, warrants for their arrest and, other issues. And, Mike works with each and every one to try to remove those barriers to get that individual into treatment so that we can actually help those individuals. And that speaks volume. I don't think a lot of people, realize, what Mike has done with his office and what his assistant state's attorneys do in order to help get these individuals into treatment and, truthfully, not into jail and not, back to the emergency room. Get them the help they need so that we're not filling up those emergency rooms, and we're not, putting them into the criminal justice system, where they don't belong, and where they're not going to get the help they need. So I didn't mean to pick up for Mike, but I kind of, was thinking, yeah, it's so true that, this was an organic thing that occurred in Elcoy at our meetings, from our committee conversations, and the furtherance is this, program that's now a national model. It's amazing.
Mike, can I have 60 seconds to add on to that, just real quick? And in addition to that, when they do go to the police station, there's someone holding a pager 24 hours a day, ready to help with the triage, where this person should go.
Right.
I'm going to a police station for my addiction problem because I'm finally ready for help. And someone's going to determine, he really needs the emergency department to treat that wound he has from injecting. Or no, he doesn't need that, but we can make sure an inpatient bed is waiting and ready for him as soon as he's ready to go there. That, to me, is an amazing thing. That's teamwork among different players. And one that hasn't been mentioned is the drug court, which I think has really evolved beautifully in this county. There was a time when I felt my patients were all being judged by the court system, and judges were telling my patients, you have to be off of Suboxone or you're not going to actually be done with us here. And now, in fact, it's a completely different situation. I know that you and law enforcement and you, Mike, have been huge supporters of that, and it's changed everything. Now the police and the courts are on our side and on the community side when the disease is now hitting up against law. It's a disease that's hitting the law. People aren't making these choices willfully once they're actually in that throw of addiction.
Yeah, I'm really proud of our drug court program, and it's a wonderful opportunity for people. And the courts have adapted, and we've all learned, and we've learned to look at this disease as an addiction, as you've described, Doctor, and really try to be, certainly as a system, more compassionate as it relates to this population, because we've all learned that this could impact anybody. And it's the really neat thing that we've witnessed just in the past several years is the transformation of law enforcement and how they have really turned 180 degrees in terms of the way they have supported the using community. It's not perfect yet. There's still folks out there that are kind of in the dark ages as it relates to this. So, certainly we don't pretend to be perfect, but the transformation of law enforcement has really been remarkable. And, there's stories of people going into the OA Out program. I've talked to some of these people that have told me that, when I went in, I was sure it was a trap. I was sure I was going to get arrested. But instead I got a hug from the police officer, and now I'm in treatment. And the last thing that those people expected, and we knew when we built the program that it was asking a lot to ask people to trust the police and trust that they wouldn't be arrested. But that's really why the program is so special, to help kind of change the culture of law enforcement, and also to get that population to look at the police in a way that perhaps they never had before as a source of help, which has been really neat to see that sea change, so to speak. Bill, can you talk a little bit about, we've talked a lot about the OA Out program and kind of how it works now, but I know you've been working with me and a lot of us recently about our plans for the future and where we want to take that program. Before we get there, though, since we've been talking about the way out, I want to make sure I give credit where credit's due. One of the main architects of that program was former Chief of Police of Mundelein, Eric Gunther, who is, he's not on this call, but he is an active member of the Opioid Initiative and really was instrumental in getting the Way Out program off the ground. And I just want to give him a lot of credit because he worked really hard to make this happen, as did everybody on the call. But Bill, talk about where we're going and where we want to go with the Way Out program.
Well, we want to do a couple things. One is law enforcement there are some barriers to when someone comes into the program, which is basically there needs to be an officer sort of sitting with them while they wait. And there's a lack of immediate beds and immediate options for care because this is a 24/7, 365-day program. So one of the things we're working on is to try to create a center where law enforcement can drive the individual to the center where we'll staff it with volunteers who will take care of their needs. Right now, we're looking for a location. We're actually working on a pretty good location, actually. But that would relieve the burden on law enforcement. The second part that we're doing is we're looking towards a solution for wellness, like a wellness center concept, because we as an organization have recognized that mental health and substance abuse are linked together. And one of the things that we found, and some data that's been collected by the county board did a study on this, was that there are probably 5 to 6 incidents a day where law enforcement confronts someone who's having a bad day, and they have 2 options. They can arrest the person and take them to jail, or they can take them to the hospital. Or I suppose there's a third option, they can leave them in place. None of those 3 options are very good. And what we want to offer is this wellness center concept where you can come to us. Hopefully we'll have social workers and nurses and a variety of people who can help you and address the issues that, you know, are causing you to have a bad day. And it gives law enforcement an option. It isn't expensive because you're not going to a hospital in the emergency room. You're not being incarcerated in jail, which is an expense. It's a very low key way of sort of helping. And, you know, the concept is to welcome everyone with open arms and help them until, you know, we can't help them. You know, one of the things we're partnering with is NACASA on that. Dr. Roberson with her organization, NERCO. You know, we have a lot, and that's the beauty of LCOI and the organization that we have, is that we're all can work very well together in a collaboration. So that's the concept. We're getting close. Hopefully we're going to have something going by the end of the year. And, you know, this is a huge partnership with a variety of organizations. And I'd be remiss to not mention the county board, who dedicated their video gaming money revenue, which is an enormous amount of money, to a variety of projects revolving specifically around behavioral health. And LCOI was very fortunate enough to get $156,000 towards the purchase of a facility or the renovation of a facility, specifically aimed at and to support the A Way Out program. So I very much thank you to them. And, you know, so this is, and also a testament to you, Mike, because I know you and I were in the room when we were getting the money. But, you know, this is a big step forward for us. And, you know, I think the service that we can provide will be enormous. You know, other things that we're talking about, and this goes to what Mary was talking about, is sober living. We're looking at, you know, exploring opportunities for sober living facilities, because we want to go from, you know, one side all the way to the other side in the ways of assistance.
So what, you know, one thing you left out there is we're going to be saving huge money if we can get this up and running. People who go to a facility like that and get the support they need are not in a hospital bed, in ER bed, waiting to go somewhere. They're not in the jail, and they're not out committing crimes. And so I like your term, a bad day. I just want to be a little bit tough on you and say their genes, their heredity, and their disease is actually acting up just like a seizure might or a migraine. And so basically that's what's happening, and we need to understand that and take care of them. It is a bad day when it happens for them, but we can help them in a lot better ways than have them go to the emergency room. The county will have more money as a result of this program.
But I think
may I say, Mike, just one thing, everything that you guys are saying is really, really important. And I'm so glad that we are embracing that. I'm also hearing that the embracing of a recovery-friendly community, because when individuals are faced with all of those challenges, and like Bill said, when they get to the other side of the fence, it's important that law enforcement, treatment providers, doctors, coroners have that recovery-friendly mentality so that those individuals can grow on that aspect. Because once you get out of treatment, once you get out of incarceration, once you get done with medication-assisted treatment, there's medication-assisted recovery as well. So LCOR has been doing a phenomenal job, I wanted to say, in making Lake County a recovery-friendly community. Across the nation with advocacy and education, is ringing bells about exactly that. And I just want to say that because a lot of times that get missed. You know, we talk about the treatment, we talk about the saves, but we have to also emphasize that recovery-friendly communities are vitally important. So thank you.
Thanks, doctor. And I know you're a huge part of that, and recovery is a lifelong process. So it's certainly, you know, we have all these great programs, but you know, nobody can be under the mistaken belief that somebody walks into the way out and goes into inpatient treatment for 30 days and they get out and then everything's fine. You know, these folks are going to need support for forever. And that's where everybody comes in, and that teamwork is so important.
Thank you.
Bruce, I thought you had raised your virtual hand there, and I wanted to make sure I got back to you.
I was clapping for the county board.
Oh.
I put my claps up there because, you know, they've been funding, you know, some of our initiatives and, you know, helped to start, you know, those initiatives. County money helped launch Text-to-Tip. And, you know, the fact that Lake County gives, you know, 100% of their video gaming revenue, which is substantial, to behavioral health, homelessness, those needs is huge. In my perfect world, municipalities would do the same thing, because what a great use of funds to help those in the county. And so I couldn't resist doing the claps because it makes just a huge difference to the providers, to the county, and certainly the clients that we see. That is a great use of revenue, and you know, that we need more of that.
Well, it's Mike and you, Bruce and Bill, who are actually communicating the message of what the needs are. You guys are communicating it so they understand what we need, and you're producing results. So hats off to all of you.
You know, one of the things I really love about our community is, you know, everybody works together, and we set issues, we set politics aside, and we can tackle very important issues like this together. And if you think about, as I've talked about before, the diversity of background, the diversity of thought that comes together in the opioid initiative, it's pretty remarkable to see. And one of the things I love about where we want to take the OA Out program is, my hope is that by having that center, that walk-in option, that we're going to be able to provide access to treatment for even more people. You know, certainly we love it when people feel comfortable walking into a police station and saying, you know, help me. But we all understand the reality of the world today, and we know that some people still might not feel comfortable doing that. And we certainly don't want that to be a barrier to accessing care, especially when it comes to underprivileged communities. And that's why I think having this center will be so important, because people can just walk in 24/7 and walk into open arms and be provided access to care, and really to have all those different issues under one roof, whether it's housing with our homelessness population, or even longer term housing, mental health, substance abuse, you know, the whole behavioral health umbrella, because, you know, we have to recognize these aren't separate issues. Many of these folks are suffering from both substance abuse issues and mental health issues. And
99%.
yeah, so that's why this center has really been a long time coming. And I think, you know, there's been a lot of different groups working on this concept from some different angles. And the fact that, you know, as only here in Lake County we've all kind of come together and we're going to get this done. And it's really exciting. It's an exciting time. We're getting close to the end here. I want to make sure if anyone has questions, make sure they send them in. We'd love to try to take questions in the last few minutes here. I know there was a comment and a question about some data in having access to a database for law enforcement. So I'd love for that person to reach out offline so I could learn more about that. Certainly, you know, we're lucky here in Lake County. We have a lot of resources. We don't have enough resources, but when you compare us to the rest of Illinois, you think of Southern and Central Illinois, where you have to go several counties over to find one treatment facility. we're lucky to have all the wonderful non-for-profit organizations and providers here in Lake County, but we really have to have a way to connect people to those services. And Lake County United Way Lake County with 211 coming online in the recent past has been a great help. Text to Tip and the app that we have now for the Way Out. Anybody can access that by going to the App Store and putting Lake County Help. You'll get a lot of information about Text to Tip, the Way Out program, our drug disposal network. There's great resources on the websites for both the Opioid Initiative and the Way Out. But getting people access to all those services is really critical. Any final thoughts as we wrap up here from our esteemed panelists?
Thank you for having me.
Is that a coronavirus molecule behind your left shoulder, Mike?
Yeah.
If it is, I'm not seeing the spike protein side of it. I think that's not fully formed, but it looks like it might be a coronavirus. Have you been working on a vaccine? Because I know you do everything else. Maybe you could come up with that too.
So that's going to be our next live stream event. No, I wish it was. It's certainly, these are rough times we're all living through together. And I know coronavirus has impacted a lot of people's lives, and we've lost a lot of lives here in our country. And, certainly as it relates to all of our work, none of us have been able to close our doors or shut down. And that's important. And certainly at the courthouse, Dr. Cooper, I think of you at the coroner's office. You're busier than that office has ever been.
Yeah.
Mary Roberson, you stepping up there to help people in need. You had the call to action a few weeks ago in downtown Waukegan to help folks. Bill, you've been there running the Opioid Initiative meetings. We've had to shift and do things virtually, but to keep that moving and to keep the momentum going. And Bruce, I can't say enough about your organization and keeping those doors open when certainly during the first stages of COVID, a lot of treatment providers closed their doors and kicked people out, and those people needed help more than ever. And you were there for those people and continue to be. So, everybody on this panel has a lot to be proud of. We certainly have a lot of work to do, but we're going to do it, and we're going to do it together. So with that, I think we're just about out of time, and I want to thank everybody that took the time to certainly be on the panel tonight. Really appreciate your time. I know you're all busy. You all have things to do. And Doctor, did you say it's your son's birthday today?
No, he just was asking me about,
Okay.
he was just asking me about, what we're doing here.
Well, tell him I said hello, and
I will.
I appreciate everybody's time. I appreciate people taking the time to log on and listen. And as I said earlier, this is the first of a series of events that we're going to do on various topics. So the next one is going to be on the 20th of August at 7 o'clock, same time. And we're going to talk about the issue of teen vaping and the impact that vaping's had on our community. And there's a lot of interesting ties to this topic. So I hope everybody will take the time to tune in on that as well. So as we sign off here, thank you. Really appreciate your time, and most importantly, appreciate all the work that every one of you has done for the people of Lake County and really beyond. So have a great evening.
Thank you very much, Mike.
Thanks, Mike.
Thank you, Mike. Bye, guys.
Thank you, Mike.